Hello there. This is Andres Arrazola Diaz with SmithLife Homecare. We're a part of Charles E. Smith Life Communities, and we are a company that does home care for elders living at home or wherever they're at. We cover all of Montgomery County and DC as well. Today we have a special guest here, Kerri Donnelly. Kerri, would you like to go ahead and introduce yourself?
Oh, absolutely. I'm thrilled to be here. Thank you for inviting me to speak with your audience. And I'm excited to talk about Montcare and skilled nursing and rehab. I am a certified dementia practitioner and certified senior advisor. I currently serve as Regional Business Development Director for Montcare, which operates skilled nursing facilities, four of them in Montgomery County, Maryland. I have about almost, let's just say, well over 20 years of industry experience. And I care passionately about serving older adults and also empowering our communities to age well, which is why I support many nonprofits in the county, including the Grassroots Organization for the Wellbeing of Seniors, the Village Support Network, the Chamber, and the YMCA, as well as other hospital and national associations.
Wow, that is a lot. You're a very busy lady, huh? And within those 20 years, can you tell us a little bit about your background? Has it all been in the sniff realm, or has it been, and by sniff, I mean skilled nursing?
Always, yes.
Oh, wow, that
My
is
whole
very,
career,
your
yes.
whole career has, oh, wow.
Mhm.
And has it all always been here in Maryland, or has it been in different states?
No, Virginia and Maryland. So I work across it currently even the Virginia, DC, and Maryland area.
Got it. Okay. And can you give
Mhm.
us a little overview of Montcare and what services you guys provide?
Absolutely. So as I mentioned, we have four centers in Montgomery County. Uh, I'll just go through the locations if that's okay. We
Yeah.
have one in Montgomery Village, which is in the city of Montgomery Village, Maryland. They have over 50 private suites there with in-room showers and newly renovated spaces. We also have wonderful top-tier center in Potomac, which has long-standing caregivers, beautiful amenities. They have memory care and a beautiful butterfly garden. We have Bethesda, which is uh, very much wanted and requested location. We are looking forward to upcoming renovations at that center. We have on-site concierge services there. And then Wheaton, which is off of Georgia Avenue, is a wonderful, warm, family-friendly environment with a strong clinical level of expertise as well. All of them are very closely located to our hospital network, and we'll talk a little bit more later about why that is. So
Yeah.
the centers actually, in terms of their services, are offering long-term residential care, but also skilled nursing and short stay rehabilitation, as
Okay.
well as memory care and respite care services. Um, Clinically, we provide for a high level of clinical care and expertise because we have on-site RNs, LPNs, and CNAs. We partner with top doctors and credential with physicians that are associated with Hopkins and Adventist healthcare. We are all very top tier centers, top rated by the Centers for Medicare and Medicaid. A few of them even were recognized by Newsweek in
Nice.
2025 as the best nursing homes in the area. We provide for care for patients that are in need of, let's say, on-site physical therapy, occupational therapy, speech therapy. We also provide for skilled nursing needs for patients that maybe are recovering from a hospital stay after a surgery or an illness. So we admit folks that maybe need IV antibiotics or wound care, maybe drain care after a surgery. Some people might have cardiac or pulmonary needs. They may need oxygen support. Perhaps they need training and education for diabetes or even kidney disease. So just to kind of give you a brief oversight of what we're doing, and
A
then
lot.
also, really just on a mission to really help our residents recover and live well, and then even return home better than when
Right.
they arrived.
Right, right, right. Yeah, it seems that every community has a different speciality, or is it all kind of the same, umbrella of skilled care?
They are all skilled nursing and rehab certified, what we
Okay.
call dually certified, meaning that we can accept Medicare, patients that are on Medicare or residents that are coming in on Medicaid as well, and all offering a different, I think, unique, like I mentioned before, unique
Yeah,
centers, right? In terms of their service offerings, their locations, but all at a very high level of clinical competency.
gotcha. Yeah, and then I know very few about it, but can you go into the differences between the short-term rehab and then the long-term care services?
Absolutely. So I will tell you that most of our volume in our industry are patients that are admitting directly from the hospital for short-term rehabilitation.
Okay,
And it typically means that someone is coming after a crisis, maybe a hospitalization due to a surgery or illness, and they're referred to us because the hospital days are very short and they still need time to recover. And perhaps going home isn't going to maximize that recovery. So typically, when someone is coming through our doors after a hospitalization, they're in need of physical therapy or occupational
right,
therapy, and they may also have a skilled nursing need, or they may need medical management. And so that really encompasses our short-term, rehabilitation service. As well as the coverage, meaning that it's usually covered by Medicare or perhaps a managed Medicare plan or perhaps an HMO, where much differently, long-term residential care, right, really is there to help maximize a person's functional abilities. So typically we'll see people direct admit from the community who are in need of someone to really provide the oversight, the 24/7 medical oversight, and also to help with what we call activities of daily living,
right,
where, we are trying to really maximize and provide for those needs. And typically, it also allows for people to get engaged with very vibrant life enrichment activities as residents. It reduces isolation. It really helps improve health and wellness for residents as well. And it's usually covered by long-term care insurance or private resources or potentially even state Medicaid, which is why our centers also provide Medicaid specialists to uh, help residents apply for Medicaid
oh wow, yeah. I'm sure a lot of
when
people don't
needed.
know a lot of their benefits. And there's something a little bit you mentioned there about the hospital days, and then I guess the is it we hospital days and then rehab days. And that's just something that I haven't heard before.
Hospital days and rehab days. So typically, when patients are in the hospital, their length of stay is quite shorter than it used to be. So, as I mentioned
Um,
earlier, right, I've been in the industry for over 20 years. So, I've seen a lot of changes over
yeah,
all those years. And back, many years ago in the late 90s, 1900s, we'll say, patients really had longer lengths of stay in their
really.
hospitals.
Okay,
Now, we are focused on, getting patients into rehabilitation earlier, right? So that they have a better outcome. And so treating the symptoms in the hospital is very important. But then once they're stable, we want to get them into recovery
yeah,
so that when they do get home, they're less likely to be rehospitalized
right.
again, less likely to have another crisis, and they can get back to their regular routines at their best.
Gotcha. Yeah, and you mentioned a lot of the things that you guys do for your residents. How does Montcare personalize the care to meet the unique needs of each resident?
Personalizing care is really important, and it has a lot to do with understanding a person's routine, their preferences, their history. All of those things can impact a person's wellness plan, right? And so a lot of that information we actually retrieve before someone even walks through our doors.
Yeah,
If you're in the hospital and you're potentially looking for rehabilitation, and we have hospital liaisons, people that are actually inside. We partner with our hospitals, and we have liaisons that are inside the hospitals to work with the hospital case management team, to work with the doctors, talk with the patients and their families. And so the information about their clinical needs and their medical management needs is obtained, but also preferences, right, and
right.
history. All of that is impacting their plan of care before they even walk in the door. Similarly, for long-term care residents, the same will happen. Only that would happen internally with the director of admissions inside a center, who will work on obtaining those preferences and obtaining the clinical information. First, because we want to ensure that we can meet a person's clinical needs. And
Right.
then secondly, when they do arrive, we have a multidisciplinary team approach where individualized assessments are taken by, all departments to include dietary, therapy, nursing, life enrichment. They all come together to interview and talk with family and residents so that the wellness plan, right, is meets the expectations. And I can give you a little example. So, for
Sure.
example, if we have someone that's maybe in the hospital, and maybe has mild dementia and had a fall at home and unfortunately fractured her hip. This is a very common circumstance. We see
Hmm.
this a lot, sadly. But we know that potentially because of her mild dementia, the family is telling us, you know what, she's great. She's really engaged in the mornings, but in the late afternoon, she's
Yep.
really tired and just she's really not going to respond well to what we're trying to do in therapy. And
Right.
so that's part of the personalized plan of care. So then we know coming in, we know that our therapist should not be scheduling her for therapy session at 3 o'clock.
You're right.
That's not going to maximize her outcome.
Exactly.
So we need to schedule her early in therapy where she's most engaged and going to get the best outcome out of her plan of care. And then even better, we continue to reevaluate those wellness plans because as patients progress or change, we want to make sure that
Right.
wellness plan is where it needs to be at any given time.
Yeah, no, absolutely. That makes perfect sense. And I mean, it just generally knowing what that, client or resident expectations and what they want to get out of rehab, I think is very, very important. That being said, does the family know a lot of the times what to expect during the admission process, or is that something all new to them, I'm guessing?
So they won't know unless we tell them because it's really not something that people really get too involved with until they're
Right.
in a crisis. And so I've actually been on a mission personally, to get out into the community, talk on podcasts like this, talk to people and active seniors and really discuss what happens, like how to prepare in advance, know their benefits. Know their benefits is very important. I talk about how to navigate your hospital stay, and all of this information can be really impactful and very helpful and relieve anxiety if
Right.
even if you know someone, right? Having the information, maybe you're not a person who, is maybe going to have a crisis, but you may know someone who might. And so having that information, empowering yourself, can be very helpful. So we work with patients and families. We try to work with them and talk them through step by step. But in many times when we get that call, it's usually a crisis, and
Yeah.
families are having to scramble, and we're doing our best to ensure that they have what they need within our centers at the time that they need it.
Yeah, and this is why I love doing this type of content and to re really get that information out there from the home care side. I mean, I think how more than half of our calls daily are crisis calls where it's
Mhm.
like we need somebody there tonight or now because the primary caregiver
Mhm.
can't handle it anymore. And whether it be at the hospital, whether it be at our rehabs here, or
Mhm.
even at home, where they're seeing that decline faster than they were expecting. And it's great to have those community partners like yourselves, that we can support each other, whether it be a discharge or whether it be at the rehab while they're, getting supervision, preventing falls, preventing elopements. So all of that is really, really great partnership to have to make sure we get the best possible care to those residents as well.
Andres,
Is there any,
so
That's,
you're absolutely, I just agree with you wholeheartedly.
yeah, I mean,
And
good.
yeah, I wanted to mention too that because we work together, we have specialty programs within our centers called Get Stronger, which helps. It's a direct admit program, which helps folks that are in crisis. So when they are calling people, I've had many calls from therapists, from home care therapists, actually, neighbors, husbands and wives, sometimes hospital case managers, but most of the time in the community, looking to find out what what we could do for them. And so we developed the Get Stronger program, which allows folks to direct admit at a reduced rate. It's not covered by their Medicare because maybe they haven't had that 3-night hospital stay,
Oh,
but
okay.
it brings them in at an all-inclusive, very reduced rate for maybe 7 days, and it really solves a lot of problems. So I encourage people to reach out if they're interested in learning more about Get Stronger.
All right, that's a great service. I hadn't heard of that. So you technically usually need a hospital stay to be able to go to rehab, and this provides a direct access to the rehab. Is that what you're saying?
Correct, correct.
Okay.
Because if you're utilizing your benefits, your insurance benefits under Medicare, and that's a whole nother podcast, but under Medicare, you'd currently have to be hospitalized inpatient for 3 nights in order to go
Right.
to rehab and utilize your Medicare benefits. And what we're finding is that quite a lot of people are being admitted, but they're admitted as on an outpatient basis. They're not technically inpatient. So that impacts their ability to go to rehab under their Medicare. And if they're not able to get an authorization for maybe their insurance, then it may be difficult. They may be scrambling at home, trying to piece things together. So sometimes Get Stronger can even allow people time. It can allow families time to get their home care and their home even in order, for their family member to, to return so that they're safe. Get Stronger can also just a week in rehab, you'd be surprised how quickly people can recover when it's maybe in a different environment. And it also
Yeah.
allows the other family members that are in the home, to continue with their daily routines as well. So there's quite a lot of reasons why someone might choose to admit for our Get Stronger program. Again, very short stay, typically 7 to 10 days, if that.
Yeah.
And
No,
then get them
that
back
makes
to
perfect
their home
sense.
care.
Yeah,
Yeah,
that makes perfect sense.
agency.
And I have we have many of our clients that after a fall, they get hospitalized, they go to rehab. Um, their new baseline is completely different than when they were at home. So they might
Correct.
need a stair lift, they might need railings, they might need things to accommodate their home when they go back, and this might give them that chance where maybe they were discharged, but they were like, "Whoa, I can't be home right now. I need those extra days," and maybe they can call one of our community partners. And get that stair lift
Yeah.
installed, get those railings, maybe get their
Yeah.
bathroom fitted to where they need to be. And
Yeah.
then that way they can get discharged once again to a safer environment at home.
You'd be surprised. I've even had neighbors helping neighbors. I've had
Yeah,
neighbors call me, just asking me about the program and how they could maybe help their neighbor to get into therapy, or their neighbor's family member, get into therapy, for a short period of time because they can see that they're struggling and they're trying to prevent
right.
that crisis from happening.
Yeah.
Yeah.
Is there anything else that we didn't cover that you would like to mention here for our viewers, Kerri?
Uh, well, I would love to just simply say that we have people recovering and progressing in our centers each and every day. And I think it's a really important message to talk about because I think that long-term residential care, which is a very important part of our service, is again is talked about quite a lot in our industry. But the message that doesn't get out is how many people are actually returning home with an amazing outcome and an amazing recovery every single day from any one of our centers. And they've worked very hard. Many of them have been through challenging circumstances after a hospitalization. They've worked very hard on their recovery. And it's just so heartwarming for me when I step into one of our centers and I meet with someone who's on their way home and they tell me about their recovery journey. And I'm just very much looking forward to sharing more testimonials with our community about the good that the industry is doing and as a partner, as a healthcare partner within our communities.
Yeah, no, absolutely. I mean, I think we don't get a lot of credit in the work that we do, but I definitely know we have a lot of amazing clients that are very,
Mhm.
very happy with what we do. So I
Yes.
really want to thank you for your time, Kerri. Thank you for being our expert today. And
Well,
I
thank you
hope,
for having me.
yeah, I hope this information gets to as many people as possible.